The reason why Manet exists is really for our patients. That's why we're here. Strongly believe that matching services and capabilities with the need in the marketplace is paramount to our work that we do every single day. It's wonderful that the communities that we do serve are extremely diverse, and we have a staff that reflects that diversity.
My name is Barbara Morris. I'm a member of the Board of Directors. I'm the longest serving member of the Board of Directors. I have been on here since 1995. From a board member's point of view, it is very rewarding because I think we see the outcomes in the community. We see the benefits that people derive from the services that we provide.
I do family practice, so I actually, in this community, I have a very geriatric practice. And so I have a lot of older folks, but I also do prenatal care. But I do end up a lot of times having family members. So I have family members and cousins and get referred from, the grandparent comes here and they want their, grandkid to come here or whatever. So a lot of times we're seeing all the different generations. I think the nice thing is that, we at Manet are able to provide care in the community, and so people, sometimes we have patients who have transportation problems, issues getting here, but they get really good care. We take time with patients. We really spend a lot of time not only working on their medical issues, but, psych issues, social issues, helping folks with their, their light bills that they can't pay. We treat them like our friends. We treat them like family. In a community health center, looking and supporting people in all aspects of their life, not just their health care.
Our relationship with Dr. Sabir.
Dr. Jennifer?
We adore Dr. Sabir.
Yeah.
She's not only a wonderful professional, she's also a real human being. So she listens to us, she takes the time with us. We never feel rushed with her. Her intuition about Stephen recently saved him from having a heart attack. So we really love her and we're grateful to her and we appreciate her.
It seems like she always has plenty of time for you. I always feel that she's always got time for that one more question or the one more thing. And what was it, about 7 weeks ago? I was having a little bit of discomfort up here, couldn't quite reconcile it, and I went to see Dr. Sabir. And she sent me to a cardiologist who saw me the next day. And the day after that, he was going to do a cardiac catheterization, and he got halfway through it and called an ambulance.
Yeah.
Again.
It was Dr. Jennifer's intuition
Dr.
and her
Jennifer's
expertise that started that ball rolling.
Yep.
Man, it's had a huge impact on our life. They've actually saved Stephen's life twice now. I don't know what would happen if it wasn't for Manet. Just not only the experienced medical care, but their knowledge of insurance, which has been huge in our life. There's been times when we've had to call on them. Many times we've had to call on them with questions about managing the insurance highway, shall we say? And we've used them for nutrition services. They're really one of our first go-to places for a lot of different things in our life and in the community. We also appreciate that they're members of the Chamber of Commerce in town, and that they participate in community events and community education. So all of that is very meaningful for us as residents of the town. Last week we celebrated our 30th wedding anniversary. It really does boil down to the little things when something like this happens.
Yeah.
Just the pleasure of his company with me.
I noticed throughout all the years that I have been with Manet, that makes a lot of difference when you know not just the language but the culture as well. Yeah, it did help a lot having someone that understands the language, the culture, and
Eu tive uma situação incrível. Eu não pude nem entender por que eu caí nessa situação.
Well, I had a very, very bad situation that I was in before, and I didn't understand why I was in that situation.
Eu caí assim na depressão.
I was very depressed.
E de querer me tirar minha vida.
And I want to just take my life.
Eu tentei 2 vezes.
I tried twice.
Eu vejo que foi uma guerra.
I thought that was like a war inside me.
Até que eu senti uma força,
And then I felt the strength
com toda certeza,
I was sure I was feeling that
que é
strength.
Deus.
That was God. I'm sure it was God.
Liguei o carro
I turned the car on
e saí.
and I left.
E cheguei aqui.
And I got here.
E quando eu entrei para dentro,
And when I walked in,
eu vi a Lisete.
I saw Alizette,
Eu agradeci muito a Deus.
and I thanked God a lot
Dentro de mim falou, foi um anjo.
because inside me it was an angel that was telling me.
Falei, Lisete, eu tô morrendo.
And I told Alizette,
A Lisete olhou para mim
I was crying.
e falou, o que está acontecendo?
And Alizette looked at me and she asked me, what's going on?
E eu falei, eu tentei um suicídio
And
duas
and I
vezes.
told her I tried to take my life away twice.
E ela falou, fica aí,
And that she told me, stay there,
não sai daí.
don't go anywhere.
Eu já estava todo
And
descontrolado.
I was feeling like under control, not myself.
E eu pensei, o que será que vai fazer comigo?
And then I thought to myself, what's going to happen with me?
Eu não tenho parente,
I don't have any relatives
não
here.
tem ninguém por mim.
I have no one here for me.
E estou tentando me morrer.
And I'm trying to kill myself.
E o que vai acontecer comigo?
What's going to happen with me?
Uma voz disse para mim, você está em casa.
So I heard a voice telling me, you are home.
Eu vou usar as pessoas para te ajudar.
I'm going to use the other people to help you.
O que me fez é porque a confiança, né, Lisete? Que eu ia chegar aqui e ter você para traduzir para mim e ter a médica também para me acudir.
Well,
Isso aí me deu a força.
so the strength that he had is because to know there was a interpreter to help him with the language and the doctor would be available to help him.
Então, isso me fortaleceu muito
That gave me the strength
para mim estar aqui.
to make the decision to come here. And I'm feeling very well. I'm feeling very good.
Sinto muito bem. Ela é
Very well.
uma pessoa muito especial.
She's very special.
When you come to Manit, you're not just seeing the doctor. We have medical assistants who are part of your care, the nurses. We have diabetic educators, nutritionists. We have navigators to help get through the system as far as the insurance. We recently added optometrist services and a pharmacy. So we're trying to incorporate the entire patient and experience within the building. When you're taking care of an entire family, you have the luxury of seeing them multiple times. You see how they interact as a patient, as a caregiver when they're bringing in their kids. You really get to know the entire family, and it really enhances the care that you can deliver for the entire family.
Well, my family consists of 5 children. I have 2 teenage daughters, I have a toddler, and I have twins. And each one of them have different needs, but all of them, when I come to see Dr. Shiner, he's very capable and able to address sort of what kind of situation we have going on. As you can imagine, with 5 children, 5 different directions, always different health issues, something's always coming up. My older daughter was having some mental health issues. So this is something new to me, you know, and depression is something very real. So when we talked to her therapist, she said, you know, go see her primary care physician. So we go in, and I'm not really sure how, you know, we have physical issues. How is my doctor going to deal with this mental health issue? And she said, I really want to make another appointment with Dr. Shiner just to check in to sort of see how I'm feeling. And coming from her, it was something kind of like, wow, you know, she even understands how nice and just she can trust him. You know, it just seems like there's no problem that couldn't come up that I could come to Dr. Shiner with my kids and feel confident that, you know, it's going to be resolved in, you know, a wonderful a manner where I can feel like they're going to be well. You know, thank God I have somewhere to go, you know, where somebody's not only can handle the physical aspect of it all, but, you know, tackle those tougher issues.
When the veterans come into the building, I love greeting them. I find myself saluting to them. They're generally older gentlemen for the most part. And I said, I'm so glad you came here. And a couple of them last week said to me, thank you, Manit, because this building is beautiful. it's clean, we can park, it's convenient. Thank you, Manet. I said, no, thank you for your service. Sometimes patients will come in and they'll say, thank you for going the extra step. Oh, thank you so much. And I let them know, this is who we are. We are Manet Health Center. We are here for you to make your life better.
E até hoje,
Until today,
aqui é minha casa, aqui é minha
is
família.
my house, my home, and here is my family.
When it comes to Manet, I feel like I'm part of the family, basically. You know, I feel like when I come here, you know, they're gonna take care of me like I'm one of their family members. So it's almost like, you know, you're coming to your mother's house, or you know, you're coming home to a place where you feel comfortable enough to, you know, get the care that you need.
Once you're a patient here, your health care is all set.
They're local, they hear you, and they'll take care of you. Manet will take care of you. We wouldn't go anywhere else
No,
for
we
our
wouldn't
health
go.
care.